Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcast listeners. Thank you so much for joining me again today. For those of you who enjoy listening to the Rational Wellness Podcast, please go to Apple Podcasts and give us a ratings and review. If you'd like to see a video version of this podcast, please go to my YouTube page. And if you go to my website, drweitz.com, you can find detailed show notes and a complete transcript. Today, we have an interview with Dr. Jeff Moss on organic acid testing. Organic acids are chemical compounds excreted in the urine that are products of metabolism. Organic acid testing has been medically validated for many years to measure specific genetic inborn errors of metabolism, such as phenylketonuria, methylmalonic acidemia, and pyruvate dehydrogenase deficiency, among others. But many in the functional medicine community have been using organic acid testing to provide information for patients about possible mold exposure, fungal or bacterial overgrowth, detoxification, oxalates, mitochondrial function, neurotransmitters, nutritional deficiencies, etc. Some use organic acids profile on all new patients as an initial screening tool. So, for example, I like to run on some of the patients Genova's NutriEval as an initial screening tool to look for nutritional deficiencies and heavy metal toxicities, but this also includes organic acids as part of the profile. There's quite a bit of controversy about the validity of organic acid testing for such uses, since at least some of these markers or ranges as to what constitutes normal have not necessarily been sufficiently validated by scientific studies as some routine lab tests have been. To sort out the validity and benefits of organic acid testing, as well as to provide us with some interesting pearls about what some of these metabolites mean and how they can help us manage patients, I've asked Dr. Jeff Moss to join us today. Dr. Jeffrey Moss is a former dentist who became a certified nutrition expert and started and operates a professional line of nutritional supplements, Moss Nutrition Products. Dr. Moss speaks regularly around the world about various topics in functional medicine, clinical nutrition, and including about organic acids. Dr. Moss, thank you so much for joining me today.
Thank you so much for having me.
Good. So what are organic acids and how are these best measured?
Right. What organic acids, number one, they're exactly what the word says. They're acids. Many of the people you work with, we work with, are familiar with the idea of, and they measure it in urine, the idea that you check the pH of the urine, and for the most part, we're wanting to see if their urine is too acid. So measuring urine acidity is a quantitative measurement, if you will. What organic acids tell us is it's qualitative. In other words, if your patient, if you have your urine is too acid, what is it in the urine that made it acid? So you're basically measuring the acids in the urine that made the acid urine acid. So that's basically what it is, what an organic acid is. As you mentioned, beyond that, they are metabolic intermediates, if you will. And basically what the body does in the course of everything it does, millions, maybe billions of times in the day, is convert substances of metabolism. You have substance A, and it's got to be converted to substance B. That's basically it. And if you just put substance A in the test tube and let it sit at room temperature, it happens real slow. And so the body, to speed it up, uses two things. Number one, it's an enzyme. And most of these enzymes require a nutrient cofactor, a vitamin or mineral cofactor, to kind of speed it up. So if the enzyme isn't working properly, or you're lacking the cofactor, the nutrient cofactor, or both, you won't get enough of the A going to B, and so you get a buildup of A. That's what you're measuring. Is there too much of A and not enough B? That's basically what you're doing with it. With this ID, if you have too much of A, for example, the assumption has been made by the designers of the organic acids test, and the profile that I use is the one from Genova, who actually came from Metametrics originally. This is back in the 90s, and the work of Richard Lord and Alexander Brawley, Andy Brawley. They came up with the initial profile. And as you said, they basically extrapolated from existing literature. Now, traditional thinking was that when you couldn't convert A to B, it was due to a hardwired genetic defect of the enzyme called inborn errors of metabolism. And when you see this hardwired defect in the enzyme, SNP, if you will, usually people get very sick at a very young age and sometimes die. But can there be varying, it's a black and white issue. Can you have varying shades of gray? In other words, it's not, yes, the enzyme is working perfectly, or no, it's not working at all, like an inborn error of metabolism. You can have a situation where the enzyme may be working less perfectly. It's working at 50, 60, 70%, and that they may be lacking in the nutrient cofactor. And so when they notice that, and the research on that, they says, well, there's a lot of sick people. The enzyme is working, but it's not working as well as it should, usually due to lifestyle issues. It may be lack of the nutrient cofactor, but we also know that maybe it's not working as well as it can because of maybe chronic inflammation caused by some type of a gut disorder, or maybe it's a toxin, a chemical or medical toxin, or maybe they're not eating enough protein, or maybe it's psychological stress. All of them can affect this enzyme activity. And so what they devised is a test where we can measure these different acids, the A's, if you will, and the B's. And from that, we can get some idea of really why people, mainly chronically ill people, why they're feeling poorly and what we can do about it.
Okay. And so do you like the idea of using organic acids as a first-line test, or do you think it's better used as a test later on, or
Sure.
Can it be used as either, depending upon what you're looking for?
From a strictly clinical academic point of view, you can use it for either, but there is a practical aspect to it, and that is that the test is fairly expensive and rarely, if ever, covered by insurance. So there are the practicalities, but dismissing the monetary issues, would it be ideal to run it on every single patient, particularly those who are suffering from chronic illness? They've gone from sometimes pharmaceutical type therapies and not getting results, basic nutritional therapies and not getting results. Certainly, it would be great to do it on every patient to detect, as you suggested, are there some nutrient deficiencies that were missed with your usual basic clinical workup? That you may have instituted therapies, they didn't work. So what did you miss from a nutritional standpoint? The NutriAvail organic acid is excellent first-line test to basically fine-tune the nutritional program. But beyond that, it's also very good for finding these other metabolic issues, chronic inflammation. From a practical standpoint, most of the clinicians that I work with do not do this as a routine test strictly because of the practical aspects. They'll do their usual diagnostic workup and treatment plan, and then what doesn't work, they'll tend to use it as a second-line diagnostic to basically answer the question, or the patient didn't respond, what did we miss? Was it a nutrient deficiency? Was there some toxin? Was there a gut problem? Maybe underappreciated psychological stress? All that can be found out with the organic acids and used as a second-line test. So it can be used either way.
So with respect to looking at nutritional deficiencies, what are some of the advantages of using an organic acids test versus using serum tests for vitamins and minerals?
Right. Basically, we have to understand the people that we are dealing with is that they don't have acute illness for the most part. They're chronically ill,
right,
and they're not in a gross malnutrition type situation. We're not dealing for the most part, although some practices
they don't have scurvy or beriberi.
Exactly right.
Yeah,
exactly right. And that's the main value of serum testing, is to tell you about gross deficiency. Most of the nutrients do not stay in the blood, in the serum, very long. And so even if they are nutrient replete, it's very time sensitive in terms when you measure it. And to see gross deficiency, they'd have to be significantly undernourished, which we tend not to see. So,
yeah, so I think the point you're making right there is that there are a few nutrients like vitamin D that you can measure serum levels and you get a pretty good idea of what the tissue levels are. But for a lot of other nutrients, serum levels really are not a good gauge of what the amount of nutrients that are in your tissues and your real need for those nutrients. So, for example, calcium, blood calcium levels are always going to stay in a very narrow range, even if the person is osteoporotic and definitely can use a lot more calcium. Ditto for serum levels of B vitamins. A lot of times the serum levels are not really accurate of what the tissue levels are and what the real needs of the person are.
But there's another big X factor that is really underappreciated, and that is, as you know, that most chronically ill people, what do they share in common? Chronic inflammation.
Right.
And what we know, the literature is very clear that chronic inflammation will alter serum levels of virtually every macro and macronutrient. And so if you're inflamed, the blood will never be a true indicator of dietary intake, either too much, the right amount, or too little. And that's the beauty of organic acids. It's what we call a functional test. What we really want to know is we basically can assume they're not grossly deficient. What we want to know is, are they taking in enough for the particular problem we're trying to address? And maybe they are taking enough, but the question is, all right, they've eaten enough. We know it was absorbed. The question is, did it go where we want it to go? In healthy people, that's not really an important question. But in sick people, it is an important question. Did it go where we want it to go? So we want to know, how was it metabolized? And that's the beauty of organic acids. It's what we call a functional test. It tells us how well the body is functioning to utilize the nutrient. Is it really going where we want it to go to solve the problem? And organic acid is superior over blood.
And also for patients who are coming to us for anti-aging programs, we want to know not just have they resolved a frank deficiency, but do they have optimal levels to function at their highest level? And this is one way to look at metabolic pathways to see if they're functioning at that optimal level, right?
Precisely. Aging itself is going to make people more prone, for example, to inflammation. There's going to be aging impact on renal function, all of which can have an impact. So just by the fact of aging, you're going to utilize it, I won't say not as well, but differently. Are you utilizing it well enough to accomplish what you want to accomplish? Again, maybe it's chronic illness, maybe it is anti-aging, optimizing wellness. We still want to know how well is the body using it at any age. Organic acids is a superior tool for that.
So when it comes to nutritional deficiencies, one of the markers that I see when we run the NutriEval is for Amino No, for glutamic
we
acid,
just call nobody
also
can
known as
pronounce that, so we call
glue, right?
it's called fig glue because nobody can pronounce that. Just say fig glue. We all say fig glue.
So this is a marker for intracellular folate.
Yes.
So how does this correlate with serum folate levels, and what is this telling us?
Serum folate is very good for gross deficiency or excess, because folate is actually interesting because of food fortification. Many people are getting excess intake of folic acid in their diet, and there's a whole body of literature on that, excess intake of folic acid.
Which is different than folate.
Exactly right. And that's another common misconception, misunderstanding, that food folate is what we find in our green leafy vegetables. What we find in a processed food is a synthetic compound called folic acid that happens to act very similar to food folate in small amounts. In large amounts, over 400 micrograms a day, the body can't metabolize. You get unmetabolized folic acid, which is considered to be, I guess for lack of a better word, a toxin.
Yes.
It is an enzyme inhibitor. And so blood can fool us because of that. But what we want to know, again, with the organic acids, with fig glue, it can tell us how well the body is utilizing what it's taking in. And so if we see fig glue elevated, it tells us, oh, it's not metabolizing folate correctly. Is it an issue of, does they need to eat more? Maybe there was a malabsorption issue. Maybe they're taking in the wrong kind. They're taking in too much processed food and not enough whole foods and getting the whole folate. Organic acids can help us make these subtle distinctions on how to proceed.
And this can also help us with patients who may have problems with methylation issues, since some of us are doing genetic testing and looking for MTHF SNPs and COMT SNPs, and these can affect methylation.
Yeah, you bring up another good point. We're bringing the whole issue of the very common SNPs with methylation pathways. In these circumstances, the individual may need more than the usual RDA or whatever it is. And so this is a functional measurement. If we see this SNP, we may have to give larger doses. So maybe the individual, the patient didn't respond because we didn't give enough because we didn't understand their polymorphism in the SNPs, and organic acids can help us understand those subtleties.
Right. Another marker, which I think has been pretty well validated even from medical perspectives, is methylmalonic acid, which is a marker for B12 status.
Yes. Yeah, when that's elevated, there is an enzyme that converts B12 to what is known as succinic acid, and the enzyme is absolutely vitamin B12 dependent. And so if there's not enough B12, and again, I emphasize enough either because you didn't take in enough, it wasn't absorbed well enough, or wasn't metabolized correctly, the methylmalonic acid will tend to go up. That's correct. So it's a good functional indicator for B12 metabolism need issues.
And really a better marker than serum B12, which is often run. Yeah.
Interesting. There's a lot of interesting research on serum B12, and that one of the risks is not when it's too low, although that can be an issue, but there's a lot of information. The serum can go too high, mainly due to inflammation. So it's a high B12, serum B12, which you see fairly often, is a good indicator that there's a chronic inflammation that wasn't fully appreciated.
It's funny. One of the panels we'll do sometimes include some serum markers, and we often see B12 high.
Yes.
But even patients who have high homocysteine, meaning that they really need more B12.
Yeah, in this case, they need B12, but there's also issue of metabolism of B12. Some of these people are already taking large amounts of B12 and not getting results because there's some type of metabolic issue. It may be a SNP, as you mentioned. There may be inflammatory issues that are going on. It could be a toxin that can act as a major enzyme inhibitor. So yeah, you can see even the elevations in serum B12, even though they're taking in a fair amount because of these metabolic issues.
or they could be taking the wrong type of B12.
Correct.
So
Yes,
they might
absolutely.
be taking cyanocobalamin, which is actually includes a small amount of cyanide
Yeah.
with their B12 instead of a methylated form of B12, which is easier for people with certain SNPs to be able to absorb.
Yeah, your point is well made in that we now understand that the old thinking was the synthetic forms of many of these vitamins. They're good enough, they're cheap, readily available, and so folic acid, cyanocobalamin, it's good enough. And maybe it is in healthy populations. But we get into chronically ill populations, aging populations, they really need a supplement that is more, if you will, bioidentical to what's in the food. And as you mentioned, methylcobalamin is more a bioidentical B12.
Or people who have any of these SNPs that make it more difficult for them to absorb standard B12. And now we're learning that a huge percentage of people have at least some of these genetic variations that make it difficult to absorb some of these B vitamins.
Yeah, extremely common now. The MTHFR SNP is considered to be about 25% of the general population. In certain populations, there is some very interesting and controversial research suggests it may even higher. The autism spectrum community suggested that it's even more prevalent, although that's very controversial, but the research is certainly compelling, if you will. So yes, very common and really needs to be taken into account for more and more people.
Yeah. I think it's more common than 25% for them to have at least one of them. And especially if you run a number of these MTHFR SNPs, because there's one or two that are typically offered, but there's actually about 15 of them.
Yeah, exactly right. MTHFR is getting the most publicity, but certainly there can be a lot of different SNPs in these nutrient metabolism pathways. Absolutely right. And so these profiles are really giving us a much better idea of what's going on.
I've really been enjoying this discussion, but now I'd like to pause to tell you about the sponsor for this episode of the Rational Wellness Podcast. This episode is sponsored by Pure Encapsulations, which is one of the few lines of professional nutritional supplements that I use in my office. Pure Encapsulations manufactures a complete line of hypoallergenic, research-based dietary supplements. Pure products are meticulously formulated using pure, scientifically tested and validated ingredients. They are free from magnesium stearate, gluten, GMOs, hydrogenated fats, artificial colors, sweeteners, and preservatives. Among other things, one of the great things about Pure Encapsulations is not just the quality products, but the fact that they often provide a range of different dosages and sizes, which makes it easy to find the right product for the right patient, especially since we do a lot of testing and we figure out exactly what the patients need. So, for example, with DHEA, they offer 5, 10, and 25 milligram dosages in both 60 and 180 capsules per bottle size, which is extremely convenient. And now, back to our discussion. So let's go to organic testing for gut health.
Okay.
What do you think are some of the most significant things we can learn about gut health from organic acids?
Organic acids right now, we have to look at it in terms of the newest generation of DNA-based stool tests. The old type of stool testing, which is they call culture testing, you basically take a stool sample and try to culture out the organisms, was okay at best. On those days, what we saw on organic acids was probably the best out there. It was not good enough to help us determine specific organisms that may be overgrowing or in the wrong place, like a SIBO, small intestinal bacterial overgrowth situation. But it could give us a good general idea that there may be dysfunction in the gut. With the new generation, though, of DNA tests, stool tests now, that is the preferred way to really determine the nature of chronic GI dysfunction. The organic acids test is good for gut, But would I recommend running organic acids for gut? No, I just say spend the money on the stool. The newer generation of DNA-based stools tests.
Now, on the other hand, if you do an organic acid test as part of your screen and it indicates there might be some fungal overgrowth, for example, then you could do a stool test to really narrow that down.
Precisely, yes. It's a good gross, your point is well made. It's a good gross screening tool. Is it accurate enough and definitive enough to tell us specifically what needs to be done in terms of lifestyle recommendations, specific supplementation? Really, no. Yeah, you'd run the stool analysis, and that'll give you a definitive idea of what you're dealing with, so you can be much more targeted on your therapies.
Right. Now, I know there's certain markers for malabsorption. Mm-hmm. What do you think about the validity of that? Because that's not something that you necessarily get from other testing.
Yeah, there's several. Many of the markers are good indicators of malabsorption. Certainly, the gut the gut section specifically is suggestive for malabsorption. But I think the sections that are underappreciated are the mitochondrial sections, the sections that relate to mitochondrial function,
cellular energy,
which would be the fatty acid sections, adipate, suberate, the carbohydrate metabolism sections, pyruvate, lactate, beta-hydroxybutyrate, and particularly the mitochondrial section. One thing we often underappreciate that was brought up to me about 10 years ago was that all of these mitochondrial metabolites are metabolites of amino acids. And therefore, generally speaking, the thinking has been they're only significant if they're too high. But if you're taking in too little amino acids or you're malabsorbing amino acids, they'll be too low. And this is an area that I've really emphasized in my courses and my teaching, that traditional thinking with a Genova profile was that the low values tended to be insignificant, the first quintile. The literature suggests just the opposite. When you see kind of everything trending low, one of the things you have to find out, number one, are they getting enough protein in their diet? And many people are not getting optimal amounts. Or is there a protein malabsorption issue, which is also very common, or a combination of the two?
Yeah, there seems to be a lot of controversy in the nutrition world right now about protein as the plant-based documentaries are proliferating, especially all over Netflix. And
Yes.
You're hearing from advocates of a plant-based program that you get plenty of protein and spinach and just eating vegetables, and there's really no need for concentrated sources of amino acids like from animal products.
Yeah, my position on that is I understand the need to have generalizations for population recommendations, but I'm a clinician. I deal with one person at a time. And so in my mind defaults to what is right for this particular person. And I find I can judge best by checking all my agendas at the door, plant versus animal. I find some people do better on an animal base, the right amount. Too much of anything is bad. But optimal amounts, some people do better on animal, some people do better on plant, some people do better on more of a Mediterranean blend of plant and animal. I tend to think of what is right for the individual, and so I find in terms of treating individuals, generalizations I find hurt more than help.
And be honest, I totally agree. In fact, I think the time for these broad-based generalizations for recommended diets for the entire population, I think we should be past that. The time for biochemical individuality is here, and I think we shouldn't be recommending the one best diet for the whole culture or society.
Yeah, we are on the same page on that. Biochemical individuality, everybody is different. And yes, I think trying to convince one size fits all is really a big disservice to the population.
Yeah, I remember going to Jeffrey Bland seminars 20, 25 years ago talking about biochemical individuality. But I think the time is really here now. Instead of trying to find the best recommended diet for everybody, let's find what program's going to be best for each individual.
Exactly right. Yeah, I was at those seminars and profoundly influenced me, and I've really been on that page ever since Bland talked about it, that we have to look at everybody as an individual, not as someone who has to fit into our agenda.
So give us some pearls about energy metabolism and mitochondrial status from organic acids. What are a couple of tests and what steps can we take to optimize the person's health on the basis of that?
I think right now where I have been most influenced, like many of us, I'm sure you're familiar with, was what is known as intermittent fasting.
Sure.
The idea not so much of what you eat, but when you eat it. And the idea is that to maintain optimal health, we have to have two basic energy periods. We have what is known as the postprandial, right after the meal, which is what we call insulin mediated. In other words, we eat something, maybe a carbohydrate, but any food, and we have a shot of insulin, which is designed to stimulate conversion to various factors such as pyruvate.
By the way, when you say a shot of insulin, this is not something you're drinking.
No, you're right. This is body makes
created by your pancreas.
Right. No, exactly. Sorry. Don't want to give the wrong effect. Yet your body, basically, you get a little squirt of insulin from your pancreas, literally. Yeah. And the food is metabolized, and this is what is known as postprandial metabolism. But then we are supposed to have a period, what they call fasting metabolism, where fat is broken down, protein is broken down, including muscle, and those are converted to energy also. Now, if that goes on too long, we're going to lose too much fat or lose too much protein, but then we have the next meal. So it's supposed to be this continual ebb and flow. So, but what we see in many people, of course, is they're grazing. They're continually eating, constantly secreting insulin. The one indicator that we look at in terms of are they eating too much, if you will, is an indicator called Beta-Hydroxybutyrate. It's a ketone body. Now, this is a fasting test. It's a fasted test. In other words, you stop eating, and then you take the urine sample the first thing the next morning. In a healthy situation, we want good fasting, fat-burning metabolism, and so we want to see that beta-hydroxybutyrate kind of trending high, so we know that we're getting good fat burning, because that's
by the way, this is the same thing that people are measuring when they're doing a ketogenic diet and They want to see that they're actually burning ketones.
Yes, exactly right. And so the beta-hydroxybutyrate is a ketone. It's an excellent measurement if you're burning fat well. So right now, in terms of two things. Number one, are you burning fat well? But also, if your beta-hydroxybutyrate is high, that means the insulin is not high. If you get excess insulin production, you're going to get production of energy in other pathways. The lactate will tend to be high. The pyruvate will tend to be high. The beta-hydroxybutyrate will tend to be a little bit lower. And now this chronic elevation in insulin called hyperinsulinemia has now considered to be a primary factor in all kinds of chronic illness. A tremendous amount of research is going on now looking at what happens when we're eating all day, constantly stimulating insulin production. So right now, I'd say in terms of general health, dietary recommendations, I'm looking at that beta-hydroxybutyrate, and if I see it not a little bit high, I'm wondering if they're eating too much, not having a long enough fasting period.
Okay. And what about any of the other markers for energy metabolism? What can you tell us about? And by the way, do any of these markers for mitochondrial function, have there been research to correlate these with like muscle biopsies to assess mitochondrial function? You know, what kind of validation has there been for some of these markers?
Yeah, good point. The specific mitochondrial markers on the profile, citrate, there's several of them. Lord and Brawley, in their book, looked at several different scenarios. And from a practical clinical standpoint, the scenarios they're so numerous and so confusing that it's really hard to apply them clinically in my experience.
Okay.
So I'm looking for trends. I've looked at the literature, and when you tend to see all these mitochondrial markers trending high, you're thinking about chronic inflammation. They're not making conversions properly. They're being inhibited, usually by inflammation. Trending low, I'm thinking about deficiency or malabsorption issue of amino acids. Now, there are some specific markers that can be looked at for other scenarios. The HMG, which is a precursor to cholesterol synthesis, that can be very high on a person on statins because it inhibits cholesterol synthesis.
Oh, interesting.
So that can be useful. Citrate. We need a certain amount of citrate in our urine.
So one more time on the HMG, because that's one I've never really paid any attention to.
Okay.
I happen to be looking at a NutriVal here. So say it again. HMG is a precursor for cholesterol, and that's what's being blocked by statin drugs, right?
Exactly right. And so if you're taking a statin drug, they can't make the conversion. The HMG will tend to go up. So if you see a high HMG, you want to rule out statins. That'd be one clinical pearl.
Or red yeast rice.
Yes, exactly. Yes, correct. Typically, red yeast rice, when taken in the correct dosages, is more metabolically kind, if you will. It doesn't have that gross effect that a statin drug would. But yes, if they're not using it correctly, you could see it with red yeast rice.
Okay, and then if it's low.
If it's low, again, you're thinking about this issue of deficiency of precursors, malabsorption, malnutrition. Very often, the people I encounter, either my patients in my small practice or people who refer to me for my customers, are older patients where malnutrition, or I shouldn't say suboptimal nutrient intake or malabsorption is incredibly common. Older people, for many reasons, are not eating well. They skip meals for a variety of factors. One of the things I find that's often missed when they analyze diets, they'll take a look at the nutrient content, and very often the nutrient content will be excellent. What they forget to do is ask, how much did you actually eat? And sometimes you have to ask the kids. Yeah, I know what you put on the plate. How much on the plate did mom actually eat? Add it up. And so this is where we get fooled. Very often in older populations, the quality is good, and we know there was enough put on the plate, but they aren't finishing their food, and they get into a malnutrition issue, which can be exacerbated by malabsorption, very common in older populations. And so if we see low, the mitochondrial indicators trending low, and I ask the question, well, tell me about your diet, and I've already done that. And I hear about the high quality, the broccoli and the fish. I hear about all that. But then my next question is, how much did you eat? And the patient, oh, I eat fine. And then I ask, if I'm available, I ask the kids, how well does your mother eat? Oh, she doesn't eat at all.
and of course,
always skipping meals.
And of course, that HMG, and so, now we're talking about the anorexic, the bulimic, the undernourished.
Exactly right. So that's what I find the mitochondrial indicators most valuable for, is these general trends.
And so that HMG pathway, which produces cholesterol, is also the pathway that produces coenzyme Q10.
Yes.
So if they don't have enough
Right.
HMG, they're not going to produce CoQ10, and that's a super important mitochondrial nutrient.
Yeah, very good point. Very misunderstood, underappreciated is the need for coenzyme Q10, and the body makes it. And yeah, we need these nutrient precursors. And again, it's underappreciated that certain populations, suboptimal intake is extremely common.
So if that HMG is high, though, and they're not taking a statin, and they also have high cholesterol, then that would be a clear correlation of something going on.
Sure,
right?
something is going on. Again, the most common thing in the ailing population is going to be looking for a chronic inflammation. They can't make the conversions. The inflammation is a major enzyme inhibitor.
Right.
Most common thing. And the next thing would be chemical or metal toxins, acts as enzyme inhibitors.
Right. Now, organic acids can also be markers for neurotransmitter status. What can we learn about this?
Oh, this is really one of the most important sections for me, mainly because when we're trying to help people who are not responding, one of the things we tend to underappreciate, or sometimes the patient can hide it, is the impact of psychological stress, worry. We're just thinking about stuff all day. And this kind of PTSD type scenario where just everything reminds them of something bad.
Being in sympathetic mode the whole day.
Exactly right. And
not spending enough time in parasympathetic rest and relax state.
Right, right. And so the indicators, homovalinate, there's a couple other indicators on there.
Acid.
Yes, the first two indicators in that profile are indicators of catecholamine metabolism, and in many people they tend to be on the high side, and that would indicate, oh, you're dealing with a stress situation. The sympathetic nervous system is just being turned on too often, most often due to chronic worry and thoughts and negative thinking. The other indicators in there relate to the serotonin-mediated pathways, or more precisely, the tryptophan-mediated pathways. Most all the neurotransmitters are derived from amino acids. The catecholamines are from the essential amino acid phenylalanine. We see how well they're converted. But the others, the kynurenine, quinolinic acid, picolinic acid, 5-HIAA, these are all tryptophan metabolites. Now, the 5-HIAA tells us about how well are we converting tryptophans to serotonin. Now, tryptophan actually can go in two major directions, and it has to do both for good health. We all know about the serotonin direction. We want some tryptophan to go to serotonin. Serotonin is like the life is good neurotransmitter. Everything's fine, no problems. The problem is when people are chronically stressed, they're inflamed, they're worried, or they have other stressors such as poor diet or toxins or whatever, the body is in a stress response scenario. And so the body says, well, life is not good. So the body says, well, we're not going to take tryptophan over to serotonin and melatonin because it's not time to sleep. We're worried. We're stressed. We have to get into the reaction phase, the worry phase, and the tryptophan is redirected to what is known as the kynurenine pathway. And there's several indicators on organic acids that can tell us about this, is how much the tryptophan is going down this other pathway. Now, it's not a bad pathway. It's supposed to be there. The endpoint of the kynurenine pathway is the production of niacin, B3. So it's supposed to be there. But with chronic stress, toxins, etc., we can get too much going down this pathway. And the big one we're looking at is the quinolinic acid. Because this is not only an indication of inflammation, it's also a good indicator of neurodegeneration. It's it's a neuroexcitatory metabolite, and has been highly linked with virtually every behavioral and neurodegenerative disorder you can think of, from depression, bipolar disorder, anxiety, Parkinson's disease, but most notably, elevated kynurenine and the quinolinic acid have been highly correlated with Alzheimer's, senile dementia profiles.
Wow, interesting.
So somebody says, my father got Alzheimer's disease at 60 and I'm 40. Is there any way that you can tell me that I'm more prone to heading in that direction? This is a good early screen. Now, it's not 100%, but it can basically say, all right, you're heading down this pathway, and now, but most people think, oh my God, just write your will, it's all over. No, this pathway tends to be elevated because of lifestyle issues. And so this is one of the things that is misunderstood. Alzheimer's disease is not a hardwired genetic disease. Maybe in 5% of the population, it's hardwired genetic. Right. The research is clear. This is mainly a lifestyle disorder. So we see the elevated kynurenine and the elevated quinolinic acid. All right, you've got a tendency, but if we can change your lifestyle, good supplementation, exercise, stress management, we can easily change this to a more health-producing pathway, most health-promoting scenario.
So what particular factors are these quinolinic acid and kynurenic directly related to in terms of lifestyle? Diet?
They go up because of inflammation.
Right.
So anything that's causing inflammation, and everybody's different. Somebody, it may be due to a poor diet. Somebody, it's due to a toxin. Infection is a big factor. One of the things that we often miss is we understand the infections like Lyme disease and viruses we're all hearing about now, but some of the infections that are most underappreciated are the infections we get in our gut.
Right.
Chronic, low-grade dysbiosis, chronic pathogens often due to overuse of antibiotics, and this can be immensely pro-inflammatory. And so when we see this elevation, one of the things we may want to check out, did we miss something in the gut?
Right. And this is where a good stool test like the GI map from Diagnostic Solutions can be helpful.
I'm a big fan of that test.
To mention, you were talking about what can we do to screen for the possibility of Alzheimer's, and I wanted to mention that Cyrex Labs has an awesome test called the Alzheimer's Lynx test that looks for antibodies to see whether your immune system is starting to attack any of the tissues related to your brain function.
Oh, yeah. Cyrex is great. These antibodies are really wonderful. And certainly if we see these trends on a basic organic acid screen, yes, we'd want to go ahead and do additional testing to gain more information. And we do that with Cyrex, absolutely.
Right. Now, the last area I'd like to touch on, you mentioned toxins, and organic acids can give us some information about toxins as well. So can you talk a little bit about what we can learn about exposure to toxins from an organic acids test?
Sure. What we measure on the organic acids is not the toxins per se, but the enzymes and the pathways involved in toxin metabolism. And for many people, this is really more important than knowing the toxin. For most people, what do we know about toxic exposure? That for most people, it's the same as everybody else. We live in a toxic world.
Right. We're all getting exposed.
We're all getting basically the same amount. But this particular person, for whatever reason, seems to be less able to handle the load that everybody else can handle. And
this person gets sick where somebody else exposed to the same thing.
The soap everybody else uses with no problem, this person reacts to the soap. They get headaches from the perfume. Why are they reacting to something that most people don't react to?
Right. You have mold in a household, and one family member gets really sick and some of the other family members don't.
Right. So why are they reacting is the key question. Obviously, practicalities aside, it would be great if we can just eliminate all the toxins. But from a practical standpoint, it's just not going to happen. The world's not going to get any cleaner anytime soon. And to tell people you've got to completely rip out all your drywall, repaint, new carpeting, $10,000 filtration system, not really practical for most people. So we want to focus on how can we better help them improve their ability to metabolize the toxins. And so the indicators, these glutathione indicators, we can look at these, what is known as the hippurate pathway, glycinate pathway, all help us tell us how well are they metabolizing these toxins. Now, history is very important. Very often, if we're dealing with an occupational situation, occupational exposure, that's entirely different. They work with it. A dentist working with mercury. People who work in beauty parlors, nail salons. These are occupational exposures where history is going to be an important indicator. But for the person, we can't find any obvious source of excess exposure. Organic acid will tell us, all right, you're having a problem with metabolizing. Is there a nutrient problem? Are you getting enough sulfur in your diet, which mainly comes from protein? Maybe they need some supplementation for that. There's the other amino acid pathways that are underappreciated, involved in detoxification, known as the glycine pathway, very important in this pathway, particularly.
What role does the glycine pathway play in detoxification?
That is involved in detoxification of key solvents, such as toluene, in particular, that toluene and these toluene type compounds are very common solvents in cosmetics, for example. You know, this is one of the things that I know very often female patients don't want to hear about, but sometimes we have to talk about this, is that I'm sick, we've ruled out the usual things, so I like to ask about the unusual, and I ask a question I know they don't want to hear. Tell me about your hair dyes and your cosmetics, which are commonly have these solvents in there. So if I see elevations, the hippurate pathway, the glycine pathway, I'm thinking about, are we getting excess exposure from solvents that can be found in things like hair dyes and cosmetics? Now, obviously, to tell a woman that you can never do that again, that's impractical and harsh. We don't want to be cruel. So what can we do to maybe create more reasonable utilization, but along with improving lifestyle, supplementation to improve these detoxification pathways so that to a certain extent they can use the things, these cosmetics they're used to, but at the same time get better health. That's how.
Well, how can you promote the glycine pathway? Is that just by taking glycine? Or?
Yeah, glycine, it's interesting. Glycine is, the body makes glycine. It's a non-essential amino acid. And so it's been virtually ignored because the body makes it. But the literature is now showing in certain selected individuals, particularly those who are having a toxic challenge, they're not making enough. And so, yes, using glycine supplementation has been very impressive in the literature for these detoxification pathways. Sure.
What other supplements can be beneficial if we see problems with detoxification pathways?
The big one that we see, the alpha-hydroxybutyrate and the pyroglutamate, these are indicators for glutathione. And the big thing with glutathione is that we're not getting enough sulfur. Sulfur is really an underappreciated mineral. It was traditionally, according to the literature I saw, was basically ignored by the research community for the simple fact sulfur is very common in red meat. And in the early days when they were doing the research, nobody ever thought you could ever be too low in sulfur because everybody was eating plenty of red meat. But now we've gotten people to stop eating red meat, and we're seeing more and more sulfur deficiencies because there's not a lot of sulfur in a plant-based diet. And what is in there is very hard to digest and absorb. So sulfur deficiency is becoming much more common. So we're looking at supplements in this case like N-acetylcysteine, alpha-lipoic acid, methylsulfonylurea, MSM can be very helpful in this situation.
Interesting. So I normally think of NEC as a precursor for glutathione, but you're saying it also supplies sulfur, which helps with that whole detox pathway as well.
Absolutely, yeah. It certainly is great for building glutathione, and many of these people have there's two indicators there. One, the alpha-hydroxybutyrate tells us how well they're making it, and the pyroglutamate, glutathione, basically you use it, what is known as reduced unused glutathione, the GSH, and the body converts that to oxidized or used glutathione. And what the body is supposed to do, it wants to conserve it, it'll take that used glutathione and convert it back to unused, the GSH, convert it. And if there is an indicator called pyroglutamate, and if that's too high, it tells you you're not recycling glutathione very well. So you're not using your sulfur well. And the other extremely important indicator is the urinary sulfate, which is often too high in our chronically ill people. And what that tells you basically is you're peeing out all your sulfur. And so, and that indicates certainly we want to do things to help improve metabolism. But with these indicators, it tells us we're probably going to need more sulfur supplementation and a diet that is more replete in healthy sulfur sources.
And what would be the healthy sulfur sources?
Well, number one, I know it's not politically correct, but a meat-based or an animal-based diet, I'm not saying too much of anything is bad, but good quality variety of protein sources. When I say red meat may be good, I'm not saying every day. And I'm not saying go to your fast food restaurant. What I'm saying is
do the carnivore diet.
Yeah, a good quality source. If you go to the farmer's market and they have these grass-fed cuts of meat, the local, and eat that maybe once or twice a week, and maybe a couple of meals a week, a couple times a week. You're going to have a plant-based diet, and then a fish-based, and then eggs. So the variety, and eggs are a very good source of sulfur. That's a really good way to get good sulfur in your diet without getting into any overload situations. And then, of course, the supplementation is very helpful.
Why wouldn't somebody recycle their glutathione?
The biggest issue, the big X factor, I keep on coming back to it, is because it's underappreciated, inflammation. Inflammation is such a massive enzyme inhibitor of virtually every enzyme you can think of. So why, and again, we know they're inflamed. What our job is to do is that why? Why are they inflamed? What did we miss?
Right.
Was it a toxin? Were they worrying too much? Are they getting enough sleep? Are they spending up to 2 a.m. on the computer? All pro-inflammatory. We just have to weed that out and make proper recommendations.
So that's interesting. So maybe we've done a CRP and that's normal, but this is still telling us that there's inflammation that's not being picked up by the CRP.
It's been thought that C-reactive protein is kind of like a universal indicator and very sensitive. And the high sensitivity HSCRP is more sensitive. But yes, you will see many people who have high excess inflammation due to other pathways, and that's where Cyrex testing, for example, could come into play very often. We know they're inflamed, but the C-reactive protein is negative. Where else? What are the other sources of indicators of inflammation? Cyrex testing can be very helpful in that regard. Okay,
good. I think those are the questions that I had prepared. Are there any other things you'd like to talk about?
I guess I would finish up by saying that the test is, there's so many people who are they're discouraged and they're confused and they're depressed because they've been suffering, and everybody is trying to throw supplements at them. Take this, take this, take this, take this. Most of these people are searching, it's cart before the horse. The issue the issue right now at this point is not which supplements to take. It's not a treatment challenge. It's an assessment. It's a diagnostic challenge. What's wrong with them? We've done the usual. We've done the usual blood test. Where can we turn to on a practical, cost-effective basis to answer that question to this patient? What's wrong with me? Right. Organic acids is a great growth screen to answer that question. What's wrong with me?
Right. Great. So can you tell us about your organic acids course and about your Malnutrition supplements?
Yeah, the organic acids course is basically came from a need I felt to really look at organic acids as more than just a simple test to determine micronutrient deficiency. I started reading the literature and I noticed, boy, there's just so much information here related to inflammation, all the things that I've talked about, and I really wasn't seeing any good information geared towards the practitioner where they could basically get this in one place. So I decided, well, might as well do it myself. And so I created a very in-depth series. It's 15 parts where I go into each section for basic an hour, hour and a half, using this idea of what did you miss, and look at each section in terms of what information can you gain to answer that question, what did I miss? It's a 15 session course, and to learn about it, you can go to our website or give our office a call. In terms of our Moss Nutrition line, it is a practitioner.
Hang on one second. I just wanted to give a plug for your course.
Thank you.
It's very well organized, very well in depth, and Jeff keeps using this sort of format that sort of reminds me of the IFM courses to organize information in terms of the different types of problems like toxins and et cetera, and to keep keeping us focused on the patient and how we can use the information to help the patient rather than getting too focused on the course, which I think is very, very helpful. So
it's very patient.
I recommend his organic acids course.
It's meant to be very practical and very patient-centered.
Okay. And what's the cost of that right now?
Right now, what are we offering it? I think it is, my goodness, I don't even know off the top of my, it's right around in the $200, $250 range.
Okay.
My wife keeps track of all of that. I can't even tell you what we're charging for it now. Okay. It's in the $200, $200 to $300 range.
Okay. And then about your Moss Nutrition line.
Yeah. Our Moss Nutrition line, it's a practitioner-based line. It's geared towards practitioners. And I emphasize that you will not find our product line on Amazon.com or any major retail sites. We do allow practitioners to sell our supplements on their own websites to their patients. But the idea is we want to have a product line that is geared specifically towards the needs of chronically ill individuals. Answering this question of what's wrong and what tools can we use specifically to help them metabolically to get to better health. We've designed products specifically for that, and in particular addressing some of the very underappreciated metabolic imbalances. Certainly we have a lot of good products, for example, for gut health, but one of the areas that's grossly underappreciated is loss of muscle mass. Very common in older populations. One of the things that's underappreciated is that most glucose receptor sites are on muscle. So that type 2 diabetes is not a disease of the pancreas. That's end-stage diabetes. Early onset is a muscle disease. And so building muscle is incredibly important and maintaining muscle. So we have products like Sarco Select that are specifically designed, particularly older patients, to help them build and maintain muscle. Acid-alkaline imbalance, grossly underappreciated. And of course, this is an issue of electrolytes. We think electrolytes, we all know about sodium and chloride and magnesium, but what's the big one that's underappreciated that you never hear about in the seminars? Potassium. So we talk a lot about potassium. We have a very bioavailable form of potassium bicarbonate. We have the pH strips to look at first morning urine pH. We talk about how to assess serum potassium. And it's one of our foundational products. And we've heard so many good reports how people don't believe, how could this complicated problem nobody could solve got resolved by electrolytes, potassium? Well, we hear about it all the time. So we're back to basics. That's the other aspect of Moss Nutrition. We will address complexity, but we like to bring things back down to simplicity and basics. And very often for many of these people, everybody assumed it was complicated, and so they never looked at the simple stuff. We look at the simple stuff at Moss Nutrition. That's the heart of our product line. Simple answers for complicated problems.
Excellent. Thank you, Jeff.
Thanks, Ben.